Have you ever heard of a story that is so disturbing or one that's just so inhumane? Well, in the world of mental health disorders, these stories are possible without the appropriate treatment of psychotropic medications. Under the Patient Bill of Rights, a mentally incompetent patient has the right to refuse psychotropic medications, and for this reason, action has been taken against this medication refusal policy because of the negative outcome of medication noncompliance. Research suggests that a person that is proven to be mentally incompetent should not have the right to refuse psychotropic medications because he or she could be a danger to himself, herself, and or to society, and the law has enforced the administration of psychotropic medications for a mentally incompetent person for the protection of all people. Keeping that in mind, I would like to present to you the two main points we'll focus on today. The first one is that people with mental illness not treated with psychotropic medications could be a danger to themselves and or to society. The second main point is that the law has taken action against the refusal of psychotropic medications for the protection of all people. In my visual aid, I display to you the main point that I would like to focus on today. Treating a mentally incompetent patient with psychotropic medications to preserve the safety of everyone in the society. As per National Institute of Mental Health, psychotropic medications have improved the lives of people with mental disorders, and without them, these people are in trouble. I would like to tell you a story that will support my first main point and show you why it's important that we have to preserve the safety of everyone in the society. On August 22, 2012, in Camden, New Jersey, 30-year-old Siobhan Thomas, a mentally incompetent woman, murdered her 2-year-old son, Zachary Thomas, decapitated his head, placed it in the freezer, and eventually took her own life in her home. Prior to committing suicide, Siobhan Thomas had called 911 in a very confused, cold mental state, confessed to the murder of her 2-year-old son, as well as the noncompliance of taking her medication Prozac. Siobhan Thomas also had a history of smoking PCP and marijuana. I would like to talk to you about my second main point, that is a resolution to this issue. The law is ensuring that people with mental illness are treated with psychotropic medications for the protection of everyone. Although under legal basis, an informed consent was constituted based on the 1st, 8th, and 14th Amendment as the right to refuse treatment, the law has made exceptions to the informed consent for psychotropic medications to be waived in emergency situations, such as a mentally incompetent patient being a danger to himself, herself, and or to society, and for the incapacity and the incompetence of a mentally incompetent person. The law is ensuring the application care or pharmacotherapy for people with mental illness because they do not have the capacity to be able to make a decision to refuse psychotropic medications and therefore should be protected and cared for by the state. The bottom line is people proven to be mentally incompetent should not have the right to refuse psychotropic medications because he or she could be a danger to himself, herself, and or to society, and the law is enforcing the administration of psychotropic medication for a mentally incompetent person for the safety of all people. And people with mental illness not treated with psychotropic medications could be a danger to themselves and to society, as well as the law is enforcing the treatment of psychotropic medications for people with mental illness to preserve the safety of everyone. In conclusion, mental illness affects everyone when it's not treated appropriately. The benefits of psychotropic medications is to treat the psychosis and give a mentally incompetent person the capacity and the competence to be able to live among society without posing a threat. Questions?
How do we force a convinced mentally incompetent patient to take psychotropic medication?
In numerous situations, a person with severe mental illness are either coerced or compelled by family members, probation officers, or professional state boards to make the decisions to take psychotropic medications in the risk of losing their jobs, family support, having their licenses revoked, or worst of all, jail time. Second question.
How do we ensure that mentally ill people are released from jail or hospital that that they will seek proper treatment?
In different communities, there are assisted outpatient treatment clinics that treat people with severe mental illness. When they are released, they follow up with treatment regimen when they are released from jail, prisons, or hospitals to prevent to prevent psychosis prolapse. The court has ordered these selectively mentally ill patients to seek treatments for psychotropic medications in order to reside in the community.
How effective are these assist outpatient treatment clinics?
Assisted outpatient treatment clinics are very effective in reducing the percentage of mentally ill people being rearrested, the decrease in rehospitalization, a reduction in homelessness, a decrease in drug abuse, which is a big contributing factor to relapse and psychosis, and lastly, it decreases the harmful behavior against oneself and to others.